Bree and Jason, I'm here at the legislature where people are lining up to share their thoughts on Bill 340. Similar to a previous bill introduced by Governor Eddie Calvo, the bill would provide $30 million in funding to the Guam Memorial Hospital to be used to pay overdue vendor payables. The money would come from refinancing existing bond debt. However, Committee on Finance and Taxation Chair Senator Michael Nicholas has publicly stated he does not plan to hear either bill on session floor. His reasoning, because the bills could substantially increase government debt. I'm here with Director of Public Health, Director James Gillen. So, Mr. Gillen, what is your thought on Bill 340?
I think that it was a good thing that Senator Rodriguez pulled it out and put it into this way to at least get an informational hearing on this. But it's a good start at $30 million, but it really doesn't solve the long-term problem. It's again paying down old debt, leaving a little bit of a cushion on what his version is about $30 million. But we really need to take a serious look and have them entertain what the governor has proposed as a $170 million refinance package, which would allow the hospital not only to pay down on debt, but also leave some cushion for other suppliers and also provide the capital that's needed to do some longer-term solutions, and that's updating the equipment, being state-of-the-art. But all of this comes, at a cost, and I think that what we have to look at is many of the, at least the print media editorials have said, policymakers have to step up and start actually funding the hospital. Even our program, MIP and Medicaid, pays at less than what the hospital needs to deliver service. But we're kind of stuck in that because the requirements from the Centers for Medicaid and Medicare to only pay what the Medicare rates are, and that equates to about 44 cents on a dollar. So it's really not very reasonable, but it's better than $0, and we have to deal with all of that too. The hospital has an obligation to provide service regardless of ability to pay. We have to figure out a way to fill that gap there, where there's still going to be people who have no means, they don't qualify for any publicly funded programs, and the publicly funded programs are getting strained. I mean, the dollars available for the care are just getting larger and larger, and we've got to come up with some solutions. And we know that tax is not a good word, but we have to find some other ways to finance the care.
Okay, good. Thank you, Director Gillen. Well, many vendors have been lobbying senators to provide or push forward legislation that would properly fund GMH. One of these vendors is JMI Edison, whose president, Ed Elau, said his company has done business with GMH for the past 3 decades. However, he said he and other vendors are frustrated with trying to collect money that's owed to them, and said if non-payment continues, they could resort to filing a collection suit against both GMH and Gov Guam. He said the issue is a life and death issue, as by holding hostage funding for Guam's only public hospital, lawmakers are holding hostage funding for much needed medical equipment and medication that could be used to save lives. Bree and Jason, back to you.